Hello, Dr. Vikram.
Hello.
I just saw you that you were recording some radio interview for San Francisco,
Yeah.
and it was really good to hear you out early morning.
Yeah.
But Dr. Vikram, as for our viewers, I felt that there were some questions that remained not unreplied, and rather they were not asked, but they are relevant information
Okay.
for our kidney patients. Firstly, I would like to ask you that how in Ayurveda you are treating it, like what all herbs you use and what is the dosage, and for how long the patient needs to continue with those that treatment that you provide.
I think I told about Punarnava in the previous interview also. There are certain other herbs like Varuna. I forgot to mention this wonderful herb Varuna. Varuna is there, Shirish is there, Bhumi Amla I told already, Bhumi Amla is there, Punarnava Gokshru is there, Kasni is there. And I'm using a blend of all these herbs. Moringa is there. I'm using the blend of all these in a wonderful formulation called Mutra Krichantak Churna. So Mutra Krichantak Churna is a powder form I'm using. I'm giving a teaspoonful morning and evening, or as a form of a tea. So patient can consume it. It is good for the symptoms like swelling in the body, or symptoms swelling in the legs, and there is increased urea and creatinine level. There is itching in the body. Patients they complain of itching, and also the weakness. Many patients they complain a lot of weakness. The HB is low, so I give Punarma Mandur to them, and Varuna Divati is good for improving the urine flow, improving the GFR. The GFR is very much reduced in kidney failure patients, and that's why this combination I'm using. I'm using a capsule formulation called the Rencure formula. So all these herbs in extract form. I'm using them in extract is when you process the herb, boil the herb and make it concentrated so that all the natural ingredients are retained as it is, and then we reduce the 100 kg batch into 10 kg batch, and then we put them in capsules. It's a pure natural form and concentrated form. It's very effective. So I'm using Rencure formula. I'm using Punarnava capsules also, and when there is too much of water retention and creatinine is very high.
Okay. And Dr. Vikram, I also happened to visit your website and get information about there is some therapy called ginger therapy.
Yeah, ginger therapy is just to stimulate the kidneys at the back of the at the back side, back of your body, on the where the kidneys are. You just boil the ginger and in water and put some towel inside, and then just squeeze the towel and warm it. Fermentation is done,
And
that improves the circulation of the kidney.
Okay.
So that is good for improving the overall renal health.
Okay.
And I'm using Kachanar Google in some cases whenever there are cysts in the kidneys. So that is also good for. And for uric acid, I'm using Navkarshik Churna. Sometimes there is too much uric acid along with the urea and creatinine, and uric acid is elevated. So I'm using the Revive Kidney package, and I have another combination called Advanced Stages Revive Kidney package. So advanced stages when the creatinine is very high, more than 9, when the dialysis is needed. So if we give this in most of the patients, the creatinine level starts to come down, and the dialysis can be avoided. And even in many dialysis patients, when we give this combination, they feel more energetic, and they feel more strength, and then the creatinine level comes down, and the frequency of dialysis is reduced. And instead of going for 2 times in a week, they go for 1 time in 15 days and 1 time in 1 month, and sometimes the dialysis is completely stopped. So this is how Ayurveda works, and these herbs work. They are wonderful.
And do you recommend to continue the allopathic medicine along with your treatment?
Yes, it can be continuous, because in some cases the hemoglobin comes very low. So there is erythropoietin is a hormone which is made by the kidneys. So erythropoietin injections are there. It should be continued once in 15 days or once in a week, if depending on the hemoglobin level. So it can be continued. Sometimes there is too much swelling, and we need to immediately reduce the swelling. So Dietary or Lasix is used, but Dietary is still better than Lasix, because it is it immediately clears away the fluid. So I am using in low dosage. I let the nephrologist decide on the dosage of Dietary. So there is no harm in using allopathic medicines along with Ayurvedic medicines. Patients, they can use allopathic medicines.
Dr. Vikram, patients generally have this query about diet. Renal patients, they are on very restricted diet, and most of them are told not to take salads and not to take anything raw. So please guide on that.
The diet of renal failure patient is very typical diet. Most of the patient, if they are on dialysis, there is a separate diet. If they are not on dialysis, then there is separate diet. If you are not on dialysis and your kidneys creatinine level is more than 5, 7 or more than 2, between 2 to 8, the diet is different. Between 9 to when you go on dialysis, then the diet becomes different. So basically the protein intake should be very less in kidney failure. When you are not undergoing dialysis, protein intake should be less than 80 grams, 70 grams per day. So the protein is all the non-veg item, all the milk and milk products, and all the pulses and cereals, the chickpeas and kidney beans and all the beans which are rich in protein. So don't consume too much of it, only about 50 to 70 grams per day. That makes it about 2 to 3 ounces in a day. So protein should be less, protein intake should be less. Water intake should be there, because as long as the urine is coming okay, you can consume 1.5 liter of water if there is not too much of water retention. The salt intake should be very less, between 2 to 4 grams in a day. Don't consume too much salt, and also monitor the salt. If the sodium goes very less, then you can eat salt. Sometimes I see people, they are on salt restricted diet, they don't take salt at all, and the sodium level goes down slowly and they become so weak they are not able to move. And we check the sodium level, it is less than 120, it is less than 125. Normal level is 133. So it comes down. So for 5-7 days you should take more salt in those cases when there is too much weakness, and you check the levels, it's very coming. And potassium, you should take care of the potassium levels, because all fruits and vegetables, they contain potassium. Especially banana is too much potassium. All citrus juices, they have potassium. So citrus juices are not recommended. According to Ayurveda also, they aggravate pitta, and pitta is causing the imbalance of protein metabolism. So that's why citrus juices, according to Ayurveda, according to allopathic system, in both methods it is not recommended. And also avoid cheese. I told you milk and milk products, because too much of protein. So green vegetables should be blanched. Just put them in boiling water, and then the boiled water should be then you take out the vegetables, and then you can cook them or use them. All packaged food should be avoided, the cold drinks, the soft drinks, because they contain carbon dioxide and caffeine, which is not good. It increases uric acid, it increases urea and creatinine levels. It should be avoided. All fried food should be avoided, deep fried food and packaged food. The cornflakes, the flakes which are coming in the packets, they are not good. The packaged juices should not be consumed. Juices in all forms are not recommended in kidney failure because of the high potassium content. Fruit juices and vegetable soups, all are not recommended.
Okay, thank you, Dr. Vikram, for this useful information.
Thank you very much.